complementary medicine, integrative medicine, and also there is a term in my head I see everywhere, holistic medicine. So could you clarify the distinctions between those terms?
Very good question, because well, complementary medicine, there is a quite clear definition. Complementary techniques or complementary approach does mean non-invasive and non-pharmacological techniques, which are not currently, like, not frequently used by conventional medicine. However, they usually originate in other important medicinal traditions, and their benefit on health is inspected by numerous evidence-based studies. So this is what about complementary medicine and complementary techniques. And integrative medicine, this term, or integrative health, is an approach which brings the complementary techniques with conventional medicine in a coordinated way. And you ask also about holistic approach. So holistic approach we can apply in whatever medicinal branch, and holistic approach means that we approach our patients as a whole. That's why holistic. Like, we take into consideration the aspect of their, not just of their bodies, but also of their minds and spirits. So holistic approach gets like across conventional and integrative health, and it's quite typical for complementary and integrative techniques, because when we approach our patients in the holistic way, we don't focus only on the physical aspect, but also we are aware of the interconnectedness between the emotions and mindset, and so the spirit, mind, and body of the people.
What role does patients' autonomy play in this? Like, for example, when a patient when somebody who wants to solve a medical problem or illness, and sees the Mehana Institute and the programs you're offering, what role does it play that the patient is kind of autonomic in the approach, or
you're right. This is what is like quite typical for this kind of approaches, that it requires or expects the participation of the patient. So it requires coordination and active approach of the patient. And also another thing, you ask about autonomy. Of course, this is the goal, to help the people to become more independent and from the healthcare system, so to help themselves. So this is the goal.
And what conditions can be treated this way, or what conditions is this particularly beneficial for?
Yeah, in general, these are all the conditions like which require to consider also the psychosomatic patterns. So it's usually what is typical, all these chronic inflammations, chronic pain, all these, for example, also the psychiatric disorders, or any imbalance of the immune hormonal systems, because these regulatory systems are very well known to be interconnected in between, and it's very hard to heal whatever disturbance of this immune hormonal systems when we focus just on one aspect. So another example, the autoimmune diseases. So these are the diseases which are quite difficult to be healed by the conventional pharmacologic and approach, and require this holistic body, mind, spirit approach.
And how can we? Is there any evidence that this can help the people with, for example, a patient with some autoimmune disease or a patient with chronic headaches? Is there any evidence that this does this work?
Yes, of course. As I just told when I explained the definition of complementary medicine, complementary medicine by its definition, as it makes part now of the Western medical approach, is inspected by the evidence-based studies. So the techniques which we present are techniques which are described by the studies. Of course, so there is some evidence, but it's like, you know, in other techniques that even in the conventional techniques, we use the approach to heal some disease by the means which we find sensible. So, of course, you can even for example, in the PubMed database, find many studies which are describing the effect of these techniques. Concretely speaking, about the autoimmune and neurodegenerative diseases, so there is a benefit of practicing of contemplative techniques and also the qigong exercise. And but you know, it's as it requires also participation of the patient. So I would never present it. Okay, now we have some proven techniques. We have one study which told that qigong exercise can heal from Parkinsonism, because it's never like this. But now what is also very interesting that we observe some health benefits of these techniques, and consequently we try to describe how it works, what is the mechanism of action. But this we try to describe by consequence. And this is what fascinates me personally, that now the research goes quite fast forward. And in the very recent years, we start to be able to explain by the word of the Western medical science why, for example, meditation or yoga practice or breathing techniques can improve some health conditions.
Okay.